Welcome to our comprehensive overview of schwannomatosis, a rare genetic condition affecting the nervous system. In this video, we'll explore what schwannomatosis is, its causes, symptoms, diagnosis, treatment, and more. Our goal is to provide you with a clear understanding of this complex disorder. Schwannomatosis at its core is caused by genetic mutations. While the exact genes involved can vary, the most commonly implicated are the SMARCB1 and LZDR1 genes. These genes act as tumor suppressors, meaning they normally help prevent the uncontrolled growth of cells. When these genes are mutated, they lose their ability to regulate cell growth, leading to the formation of schwannomas, tumors that develop on Schwann cells. It's important to note that in some cases, the genetic mutation occurs spontaneously and is not inherited from a parent. The pathophysiology of schwannomatosis centers around the development of multiple schwannomas, which are benign tumors that arise from Schwann cells. Schwann cells are responsible for forming the myelin sheath, a protective layer that insulates nerve fibers and allows for efficient transmission of nerve signals. When schwannomas grow, they can compress or damage nearby nerves, leading to a variety of neurological symptoms. The specific symptoms experienced depend on the location and size of the tumors. Unlike neurofibromatosis type 2, acoustic neuromas, also known as vestibular schwannomas, are typically absent or less common in schwannomatosis. Schwannomatosis is a relatively rare condition, and precise figures on its prevalence are still being researched. Estimates suggest that it affects approximately 1 in 40,000 individuals. Because it can be difficult to diagnose and is often confused with other conditions like neurofibromatosis type 2, the true number of cases may be higher than what is currently reported. Schwannomatosis can occur in people of all ages, races, and ethnic backgrounds. The signs and symptoms of schwannomatosis can vary significantly from person to person, depending on the location, size, and number of schwannomas. The most common symptom is chronic pain, which can be localized or widespread. Other possible symptoms include numbness, tingling, weakness, and muscle atrophy in the affected areas. Some individuals may also experience headaches, hearing loss, or balance problems, although these are less frequent than pain and sensory changes. It's crucial to remember that not everyone with schwannomatosis will experience all of these symptoms. Diagnosing schwannomatosis can be challenging due to its rarity and the variability of symptoms. The diagnostic criteria typically involve the presence of at least 2 schwannomas confirmed by imaging studies such as MRI or CT scans. Genetic testing for mutations in the SMARCB1 and LZDR1 genes can also be helpful in confirming the diagnosis, although a negative genetic test does not rule out the possibility of a schwannomatosis. It's often necessary to rule out other conditions, such as neurofibromatosis type 2, before arriving at a definitive diagnosis. While there aren't official classifications or subtypes of schwannomatosis, it's important to distinguish it from other neurocutaneous syndromes, particularly neurofibromatosis type 2. The key differentiating factor is the absence, or relative rarity, of bilateral vestibular schwannomas acoustic neuromass in schwannomatosis. This distinction is crucial for proper diagnosis and management. Currently, there is no cure for schwannomatosis, so treatment focuses on managing symptoms and improving quality of life. Pain management is a primary focus, and this may involve a combination of medications such as pain relievers, antidepressants, or anticonvulsants. Physical therapy and occupational therapy can help improve strength, mobility, and function. In some cases, surgery may be an option to remove or debulk schwannomas that are causing significant pain or neurological deficits. Stereotactic radiosurgery, such as gamma knife, can be considered for some tumors. Regular monitoring with imaging studies is essential to track the growth of schwannomas and detect any new tumors. Because schwannomatosis is a genetic condition, there's no known way to prevent it from occurring in the first place. Genetic counseling is recommended for individuals with a family history of schwannomatosis or who are considering starting a family. Genetic testing can help determine the risk of passing on the mutated gene to future generations. The prognosis for individuals with schwannomatosis varies depending on the severity of the condition and the effectiveness of treatment. While schwannomatosis is not typically life-threatening, the chronic pain and neurological symptoms can significantly impact quality of life. Ongoing research is focused on identifying new therapeutic targets and developing more effective treatments for schwannomatosis. Recent studies are exploring the potential of targeted therapies that specifically inhibit the growth of schwannomas. Clinical trials are also underway to evaluate the safety and efficacy of new medications and surgical techniques. With continued research and advancements in medical care, the outlook for individuals with schwannomatosis is improving.